Before choosing any fertility expert, you must go through rating, review and experience of that person. In this video, I am going to talk about what you can expect at your first visit with your fertility expert. Let's jump into the video. As soon as you are done with the formalities, the most asked question would be related to your cycle history, that you have regular cycle or you have irregular cycle. Then your health provider will ask questions related to how frequently you are making relationship during your ovulation time and how long have you been trying for baby. Those kind of questions will come across when you start talking to your fertility expert. After doing all those kind of introduction and those kind of question and answer, he or she will suggest you the first test, that is called pap smear test, and it is also called pap test, and it is a very common and general test. Your provider will collect the cervical mucus sample and they will send it to laboratory for further testing that you do not have any cervical infection. Besides that, now I am going to talk about what blood tests are important which your fertility expert will suggest you. The first blood test is follicle stimulating hormone test. This test will tell you about the quality of follicles you have in your ovaries. Besides that, follicle stimulating hormone is also responsible to stimulate your ovaries for producing good quality of eggs. If this hormone has increased level, then you have to take medications for that. The another test would be related to AMH level test, and as you know that this is also a simple blood test, and this test decides the number of eggs in your ovaries. If your AMH is pretty low, then your fertility expert will decide accordingly. The another test would be related to LH hormone test during your ovulation time. The surge of LH hormone is very important because it decides your ovulation. That will be also monitored during your ovulation time. If your thyroid level is increased or decreased, it really matters when you are trying to conceive. Once you are done with your ovulation, your progesterone level is really important to establish a healthy pregnancy. That test will be done as well to check whether your progesterone is increasing once you are done with ovulation. Besides that, estradiol test is also important because it really helps to stimulate the ovaries to produce eggs. Once you are done with all those blood tests, after that your fertility expert can suggest you to check whether you have any blocked fallopian tube. For that, he or she can prescribe you HSG test, on which I have already prepared 3 videos, so you can go through that video. It would really helpful for you to do prior preparation before your HSG test. Once you are done with HSG test as well, after that your fertility expert will take the next level and he or she will prescribe you medication that would be really helpful to stimulate your ovary so that you can produce 2 or 3 eggs, and those eggs should have good quality. That would really help you to conceive naturally. If that thing doesn't work as well, after that he or she can suggest you IUI and later on IVF as well. These are the few steps you can discuss with your fertility expert during the first visit of this meeting. I hope you have liked this information, and if you think this information has added value in your life and it would be helpful for you to solve your problem, then please take a moment to subscribe my channel. I will see you in my next video. Thank you so much. Bye bye.